Hello and welcome to What the Health. I'm Julie Rovner, Chief Washington Correspondent at Kaiser Health News. Once a week, I invite some of the smartest reporters in Washington to our office to chat about the latest in healthcare and health policy news. Our full conversation is edited into a podcast, which you can find by going to www.khn.org. On today's show, I'm joined by Anna Edney of Bloomberg News, Joanne Kennan of Politico, and Kimberly Leonard of the Washington Examiner. We're going to break down some big health topics that could impact your daily life. Today we're going to talk about the Texas lawsuit that has once again put the Affordable Care Act in legal doubt, nearly final numbers for open enrollment for health insurance under the Act, and we'll have year-end awards for the most significant health policy stories. Let's dive in. So we're going to make this mostly a year in review, but I feel like we need at least some update on the court decision out of Texas, holding that the ACA, now lacking a tax penalty to enforce its individual mandate, is unconstitutional in its entirety starting January 1st. I find the reaction to this has been kind of curious. Democrats, of course, are decrying the ruling, along with what appears to be a lot of health lawyers and analysts, including some fairly conservative ones. But what we've heard from Republican elected officials, other than the president, is mostly crickets. Has anybody heard much more, Anna?
Well, I think what we've heard most publicly is, the Democrats tried to force a vote in the Senate to intervene in the lawsuit as it moves along, and the Republicans immediately rejected that. And so, that's the most strategy we've really seen so far, and it doesn't say a lot. And I think that Democrats did that, it was a safe move because they knew that Republicans would reject it immediately. And so there's just going to be a lot of trying to figure out what the strategy is from here.
But finger pointing in the meantime.
Definitely finger pointing, always finger pointing. And I think there's questions. There just seem to be a lot of legal questions around this lawsuit, as well as the one that was filed by the Maryland Attorney General Brian Frost to try and kind of be the backup if this really, does take effect in some form much further down the road. Whether that could actually, even be filed as well for some of the same reasons that have been brought up about this case and whether they had standing for this case.
Kimberly, what are you hearing?
Well, in interviews with Republicans on the Hill, they certainly sought to distance themselves from the ruling, but they did echo a lot of the president's calls for coming back to the table on health care and coming up with a new health care plan. Democrats are more interested in going through the courts, appealing this, potentially getting it to the Supreme Court, and going through it legally that way.
Joanne, you wrote a story about this, as did I. Remind our listeners what would happen if the ACA actually was found to be unconstitutional in its entirety?
Well, the political debate is focusing on the people who got coverage directly through the ACA. In other words, the roughly 9 million who are in the exchange, or I guess next year is looking like 8.2.
We'll get to that in a second.
Between 8 and 9 million who will be covered in the exchange, the 12 million newly eligible for Medicaid who are in the Medicaid expansion. So we're talking about sort of a rough 20-ish million. And pre-existing conditions. That's what's taken sort of the air up in the debate. But actually, the ACA has changed pretty much everything about our healthcare system, from obscure, wonky payment things that we will not try to, inflict on our listeners. But the entire healthcare system has changed. And middle-class people who are getting insured at work are getting all sorts of benefits that they don't even think about anymore. They've been getting them for a couple of years. They take them for granted, and they do not realize, there's polling data to support what I'm saying, they don't even realize that it's from the ACA. So if you're getting your kids, well baby visits free, that's because of the ACA. If you're getting birth control free, that's because of the ACA. If you're a senior getting more help with the Medicare drug costs, the donut hole, that's from the ACA. If you no longer have caps on how much your insurance will cover in a year or in your lifetime, which is, luckily for those of us who are healthy, that's not a big deal. But if you have some chronic disease that's going on with expensive treatments year after year, it is a big deal. That's from the ACA. And there are others, but those are the biggies. Covering your kids until they're 26 is from the ACA. Taking all that away, we don't think it's very likely at the end of the day that it's going to be taken away, but it's great political talking points in the meantime.
Well, and I updated a story that I originally did in 2012, the last time this was before the Supreme Court, about how if the ACA went away, it would just completely make a mosh, not just of all the things that were in the ACA, but the ACA is now basically infiltrated into the rest of the healthcare system. So it would throw everything up in the air. Examples of Medicare payment regulations that are premised on authority in the ACA, that would have to be completely, Medicare would lose its ability to pay for lots of things, and they would have to go back through the regulatory process, which takes months, as we've also talked about.
This ruling, would even take away menu calorie counts on menu labels, which has really nothing to do with the individual mandate tax. But this law has really permeated. We don't even think about it anymore. I mean, we still fight about it, but when we fight about it politically.
This will certainly drag on into next year. And one more bit of news. We got final numbers, sort of final numbers, for people who signed up for insurance at the Federal Insurance Exchange, healthcare.gov, and they were kind of surprisingly high, down only a couple of 100,000 from last year, even though the mandate went away and everybody predicted that the bottom would fall out, and the administration took away most of the outreach money. Anna, what happened?
Well, it seems that people still want health care, and they still want the subsidies that they're able to get through this. And so there were about 8.5 million that signed up. So that's 4% or so lower than last year. But there were estimates that it could be 12% lower. So this, I think, is proof that the law is still pretty strong, the market is still pretty strong despite kind of attacks on the law.
And these numbers, we should point out, don't include the state exchanges, including big ones like California.
And New York. Yeah.
And New York.
The total enrollment will be higher. And also there's some late dribbler ins. This is not the final. And it will be higher.
And it doesn't include the people who will be automatically re-enrolled because they didn't come and shop.
No, it does. I believe it covers.
Oh, is that covered? That's the re-enrollment too?
Yes.
Oh, okay.
Yes, those who aren't included are those who had called and left their information. There are about 200,000 of those. And then every year, right after the open enrollment deadline, you have a lot of people who see that they were automatically re-enrolled into a plan and then they disenroll. So there tends to be a little bit of a drop there as well. So there's going to be some adjustment. We'll probably have new numbers in the next week if last year was a good indication of when to expect all this.
And of course, people who don't, these are the people who signed up, but the people who actually get enrolled are the people who pay their first month's premium, which is, right, there's another drop off there.
There's this terrible word called effectuated enrollment, which I do not let my writers use in print very much. But that basically means you paid your bill. So, and there's usually some drop-off. People who sign up don't pay, or they don't pay the whole year, or there are other things. And I think the other thing we should point out is that part of the drop-off, I think there are two things I'd like to point out. One is that it has dropped since its peak, which was around between 12 and 12.7 million or something was the peak a few years ago. It has dropped since then. It did drop last year and it dropped this year. So it did not implode, which is the word that we've heard many Republicans use. It certainly did not implode. It is doing what I often call muddling through, and we're still in the muddle mode. But the other thing I think that we have to remember is, the individual market is a stopgap. For most people, it's temporary. If you're self-employed, it may be forever. But for a lot of people, it's between jobs or after a divorce or various things that happen. It's a stopgap. It's not where you are for your whole life.
After this break, we'll talk about the biggest and most important health policy stories of the year. Let us get to our year-end awards, where we're going to talk about the year in health policy. We're going to divide this into categories, and at the end, we will each have our extra credit stories for the year. So the first category is biggest, most important story of the year. Let's go around the table. Anna, what's your biggest story of the year?
My biggest story of the year is on vaping and the regulations that FDA has been looking into to try and oversee this. What happened was there has been this epidemic, as the FDA commissioner called it, of kids using e-cigarettes, and there's a company called Juul that's very much the one that is selling many of these to kids, and that the kids really like. And I think what we're seeing this story turn into a little bit, and this is just very recently, is an even different arm of the story that's also very big, is that the tobacco industry wants to sort of have a smoke-free future. And so we saw Altria, which is the maker of Marlboro cigarettes in the U.S., invest a large amount, more than $12 billion in Juul. And so I think it'll be interesting to see how this goes forward and how the regulation works out. But the regulation was surprising because the the administration essentially admitted it kind of made a mistake because it had originally tried not to regulate e-cigarettes as much, and now it's kind of going back and looking at some of the things that it could do to stop kids from using these devices.
Kimberly, what's your biggest story of the year?
I had the Medicaid work requirement. It's only gone into effect in one state, which is Arkansas, but so many other states are looking at it. And essentially what the work requirements do is they say that for certain people on Medicaid who are non-disabled and who are adults without kids, you have to be required to work. Usually it's around 80 hours a month. And if you don't record that you're working, then you can be booted off of Medicaid. And so the program went into effect in Arkansas about 6 months ago, and so far they've had about 17,000 people who've been disenrolled from the program. Other states have been approved, but they haven't started yet. So they're Wisconsin, Kentucky, Indiana, New Hampshire, and then several other states are still in line to get there. The Trump administration has been encouraging these. I think it's the story of the year because it marks a big change to the Medicaid expansion that was put forth under the Affordable Care Act. And it remains to be seen whether the courts are going to allow it to stand. There are 2 lawsuits pending right now, but it seems to have really made a difference in, the way that the program is probably going to be, set up in the future under the Trump administration.
I'm going to jump in here because I'm going to build on that because my biggest story of the year was Medicaid, both the work requirements and the expansion that Joanne talked about, that we had these really conservative states, Utah and Idaho and Nebraska, voting to expand Medicaid. And, in addition to Virginia, which had sort of split government, a very conservative Republican legislature and a Democratic governor, so they hadn't been able to do it until they finally basically changed the legislature. But I think, these last holdout states that hadn't expanded Medicaid, where they get 90% of it paid by the federal government, I think we might be reaching a tipping point on Medicaid in general.
And Joanne, I believe that we now have more people on Medicaid than Medicare, right?
Oh, they have for years, actually. There have been more people on Medicaid and Medicare. What's your biggest story?
For someone who spends all of my time dealing with the issues that we talk about on this podcast, which is, a lot about financing and coverage and the politics and the fighting, I actually think the story we have to step back and really think about is the declining life expectancy in the United States of America in the 21st century. It's now 3 years. It's 2 years of decline and 1 year of flat. So we've had 3 years without anything getting better. In fact, it's gotten worse. And for complicated reasons, it's not just opioids and suicide. It's more than that. There's really things wrong with the quality of our care, who's getting our care, how we think about care. And I guess I still find that shocking after 3 years, and I think maybe that should be the biggest story.
I think you're right. All right, next category. What was the most over-covered story of the year? The one that too many people wrote about to the detriment of other things that they could have been writing about, like the lowering life expectancy.
I'm going to take a piece of the drug pricing debate, but a small piece where over the summer, the president tweeted essentially at Pfizer, and Pfizer came back eventually and said they weren't going to raise drug prices until, they were going to put a halt on it until January, essentially. And then all these other companies jumped in and followed or lowered prices on some drugs, but they were mostly drugs that didn't matter to their bottom line. And so there was this big, reporting push on, look, Trump's tweet was effective and these companies are doing all this stuff. And there was some cynicism about it as well, but I think there were a lot of stories about this, and now we've seen just today Reuters is reporting that about 28 pharma companies are going to raise prices come January, and those price increases are going to be larger than usually they are. And so I think it was a little bit premature to kind of give Trump a win on that one, and there was just a lot of reporting without enough skepticism maybe to go with it.
Well, and I know I'm going to get lots of mail about this, but I think that Medicare for All was maybe a little bit overhyped this year. Not that this is an incredibly important debate. It's a debate that we as a society need to have about what we're going to do about this dysfunctional healthcare system where people aren't even living as long. But I think some of the breathless stuff about Medicare for All this year, as if all you would have to do is elect a Democratic president and Democratic Congress, and they could do it the next day. I think we need a whole lot lot more, looking a whole lot more deeply. Yeah, it's true. I know we do. Right? I'm just saying for this year, I think it was the most overcovered story. Did you remember yours, or was that yours also?
I think I agreed with one of yours in the email last night and said, yeah, that's it.
Yeah. All right. Well, what about the most undercovered story, the story that we should have spent more time on? Anna?
My most undercovered story is drug shortages. This has been a problem for several years now, and administrations have been trying to get at it. What happened this year is that shortages have gone up. They almost doubled in just a short amount of time. And the FDA pointed this out. One of their economists did just the other day, and I don't think it got a lot of traction. I don't think shortages this year there's been much reporting on it because it has kind of been an ongoing issue, but it's an even bigger problem. A lot of it due to the quality of manufacturing, and a lot of it due to consolidation in the industry, and it's really squeezing hospitals because particularly these are injected drugs that are sterile, and companies are having trouble making them. I mean, even saline is in shortage, and that's, they can't get them, and they're paying more for them often because the prices then go up.
Really important story. Kimberly?
Yeah, I picked kind of a weird one. So the Trump administration's FDA has been receiving kind of a lot of flack over what you were talking about earlier, Anna, with the vaping, saying that, this is one area where they appear to be overstepping, what happened to the deregulatory agenda, et cetera. But one area that's pretty similar to that is how the FDA has been dealing with kratom. Kratom is a drug that is currently not illegal.
It's not a drug, right? It's a supplement.
Well,
it's
a drug in the sense of it alters your brain, but it's actually an Asian tea leaf, and people do use it in tea. They sometimes smoke it. They sometimes take it in pills. The FDA is calling for the DEA to schedule it as a Schedule I drug. So, things like LSD and marijuana, it would end up falling into that category. And defenders of the drug say, wait a minute, a lot of people are taking it because it helps alleviate opioid addiction, or it helps with depression or chronic pain. Shouldn't we have another outlet to do something about this? But the FDA has been putting out a lot of different reports on the drug, including one about how it has been associated with 44 deaths over the past 9 years almost. They have another report they put out talking about how it had metal in it, or how it was like salmonella, or how it was really similar to opioids. And people who defend the drug say, well, wait a minute, you have a lot of other legal drugs that have caused significantly more deaths over this time period. So they want the opportunity to be able to do studies and find out whether it could be something that is medical and not have it face the same kind of fate that medical marijuana has faced. So that's my pick for undercovered.
Joanne?
I think it's, we certainly have a lot of coverage on the opioid crisis, but what's also going on in this country is we have increases of drug abuse and fatal overdoses of a whole lot of drugs. It's not just opioids. We have an addiction crisis. Cocaine use is up, meth is up, benzodiazepines is up, and people mix them. And then now there's fentanyl in the drug supply of some of these other drugs. And people are, I'm not saying that focus on opioids is wrong. We obviously have to focus on opioids, but it's a bigger problem and we're not paying attention.
In 2 minutes, we'll be back with our extra credits for this week. We are back, and it's time for our extra credits. That's usually where we talk about our favorite stories we read this week, but in the spirit of the end of the year, we're going to have each panelist tell us what their favorite article or book of the year was. Some, but not necessarily all of these, are ones we've recommended before, but we think they're worth another plug, and we thought these might be helpful over the holidays if your flight is delayed or if you just need to escape your relatives for a while. Joanne, why don't you go first?
Bad Blood. We have talked about it before. I love that book. We love the book. I think all of us have read it. We all loved it. It's how do I pronounce his name? John Carreyrou's book about Theranos. And even if you think you know this story of the blood testing lab that spectacularly and fraudulently collapsed, it's a great yarn. It reads like this fast-paced action novel, only it's about blood testing. It's great. It's just wonderful. And it's short. I read it with you guys on a plane. It's a few hours. And when our plane got delayed going to Austin, and it's just a really good book, and you don't have to have technical expertise about genetics or blood.
Kimberly?
So I picked the article, Here's How Cornell Scientist Brian Wensick Turned Shoddy Data into Viral Studies About How We Eat. And it's by Stephanie Lee. And I picked it because... At BuzzFeed, exactly. I picked it because I've been, reflecting a lot on, and I often kind of talk to scientists who say, why don't people trust scientists? And I'm kind of like, why don't people trust journalists? And we kind of like have a back and forth about that. And it's because of instances, like this. Trust is something that is extremely hard to gain, extremely difficult Trust is something that is very hard to gain, and it's extremely easy to lose. And so I've just been reflecting a lot on that. And I think that, there's a lot of parallels with the media and, science and credibility and public trust. So that's why I chose it.
On the other hand, this was journalism that actually, there were a lot of stories this year that created results. Most of his papers, I think at this point, have been retracted. He's losing his job as of next June. So this was something and this was uncovered by this journalist at BuzzFeed.
Absolutely.
Anna.
Mine is Atul Gawande's piece in The New Yorker, his article, Why Doctors Hate Their Computers. And I thought it was such an interesting look. We very easily kind of make fun of doctors for using the fax machine and kind of for not wanting to get behind technology. And what this really looks at is the use of technology, and sort of you'll see a lot of the doctors now switching over to electronic records. And what he talked to was someone who has done, a doctor who uses these but has to work after work just to keep up with it. And I think for me it was just such an interesting look at a problem that has kind of been easy to make fun of, and doctors not really wanting to switch over to electronic health records and things like that. But really, does it actually make a difference for the patients? What are doctors saying about it? And really good doctors who, are willing to get up to speed on these kinds of things. It's really making their lives harder. And so it was a surprise to me to read it. And I think that would, be something people might want to take a look at.
Yeah, I think the idea was that, we would be able to have all of this medical information no longer locked away in individual file cabinets, but it could be aggregated and used for research, and it could follow the patient around to different doctors. And I think what we've ended up with is doctors and patients who are unhappy because there's a screen in between them and the doctor.
Right.
And
that's... We have a pediatrician who's really good at typing on his tablet while still looking at a kid about why he should eat more vegetables. So it can be done.
But they can't. But they're having trouble making the transition.
Yes, I've also seen. I have had family members in situations where where it's a screen and no patient. But I've also seen that it can work.
Yeah. All right. Have we gone around?
Yes.
Yes. Oh, so it's me. Sorry. Mine is a story about something we talked about many times, including earlier today, work requirements for Medicaid. It's a deeply reported piece in the Arkansas Times by Benjamin Hardy called Locked Out of Medicaid. Arkansas's work requirement strips insurance from thousands of working people. And it's a look at some of the actual people who make up the now 17,000 individuals who've been stripped of their Medicaid coverage for failing to report their work hours online. As we've discussed, many were working but unaware of the requirement, or aware of the requirement but unable to navigate the very complicated website. I would point out that since the story ran in November, the state has agreed to allow people to report their work hours by telephone, but apparently that has proved difficult as well. So this story, too, will continue into 2019. So that is our show for 2018. Thank you for listening. Also, as usual, you can email us your questions or comments. We're at whatthehealth, all one word, at kff.org, or you can tweet me. I'm at Jay Rovner.
At Anna Edney.
At Leonard KL.
At Joanne Cannon.
We will talk to you soon. In the meantime, be healthy.